Well, I must say that the facilities in here are state-of-the-art facilities. These facilities are strategically put in place here to enhance virtual reality learning for students, especially when it comes to simulation. And we realize that simulation is a sort of instructional media whereby students are put in a situation where they learn real-life experiences, but in a simulated manner.
Simulation helps students, first of all, master so many things. You know, there are things that you would hardly master when you do it once. And for you to be able to be given the liberty to practice so many times, you know, these are not human beings. So if you happen to have an opportunity to practice on what you have, it's at your disposal. You're able to actually do your best and get the skills that you require very well.
Initially, it has been quite challenging when you go to practice on real patients. Some of them will actually say that I don't want to be delivered by a student. But with these money kids and simulation situations, you find that by the time you go to the patient, the real patient, you're already competent enough to conduct the delivery, even in cases of complications and all that.
Any surgical procedure has a learning curve, and this learning curve can be quite steep for new trainees. Simulation-based training helps us overcome this learning curve, helps us do it safely on the patient, which is avoiding any unexpected complications or outcomes from the surgery. And simulation is key in helping us do it safely.
My favorite simulation space is the maternity. Yes, I remember the first time I was a student, when I saw a woman deliver, I was so shocked. So many things. I think any student who is attending AKU will be very excited to, first of all, have first-hand experience, though simulated, but first-hand experience of exactly how a delivery room looks like.
On patient care, I mean, it's obvious because you understand that when a student goes through a simulation, they gain first-hand skills. And the same skills will be transferred now to a real-life patient. So this is to say that our patient care will be top-notch, it will be improved, and there will also be elimination of obvious risk and probably, let's talk of risk and maybe negligence, you know, because through simulation you'll be taken through real-life patient care, and you'll be in a position to assimilate and even understand and even be able to anticipate problems even before they come. So that means patient will be dealt with in a safer manner, and the care according to the patient will be of high standards and acceptable level.